What's up, Andy?
Hey, how's it going?
Um, yeah, it could be better, but there's a lot of crazy shit going on right now. It's probably the last day that we'll be able to do this for a long time, so we're gonna get this video and make it for you guys out there. Gives us a little peek in the life of how Andy's been for a while. But
Yeah.
everything going with the coronavirus going on right now, man. What you thinking? How you doing?
Well,
And you got any good advice for people out there?
well, for anyone who has any organ transplants, it's pretty much your life now. So everyone else is now doing this life, and you just have to pay attention to what you touch with your hands and where you touch with your face,
Yeah,
um, and be diligent with the cleaning. Cleaning the surfaces and sanitizing when you touch things like salt shaker
yeah.
or doorknobs,
A lot of us,
anything that you touch publicly.
yeah, a lot of us are just kind of getting used to that. It's a
Yeah,
routine you've had to do your whole life. Just recently, my wife and I, we started sanitizing everything coming in and out of the house. This seems like a day in the life. And you, how do you kind of go about it?
I mean, right out of transplant, it was definitely very strict like that. Needed to sanitize, wipe down every surface before meals, sanitize, clean everything, make sure the meal was prepped to the cleanest standards.
Right?
Now I've laxed a little bit and can
Oh, for sure.
be relaxed up until this point. Now Corona's making me up my game a little bit.
Yeah.
Back to sanitizing things daily.
And this is a relatively new virus, though. It kind of puts us all on the same playing field that you've been on. So,
Right.
like, if anybody can relate to a transplant patient right now, this is kind of something that they've had to deal with, whether it's lungs or any other vital organ,
Yeah, you
for a
just
long
have to
time.
you just have to treat every germ as if it's the same because to us that they're equally as dangerous, more or less. I don't want to say equally, but
Yeah.
if you think of it that way, you
I mean,
just
for
stay
you,
cleaner, easier.
for you, it's probably equally dangerous, right?
I mean, some things are worse than others.
Okay.
I mean, there's a spectrum,
Yeah.
but
So when
it's easier just to say everything's bad and
I
go
got you.
at it like that.
Like what's how do you go out of the house? Like before you go out of the house, do you do anything different than say your roommates would do, or before you come in the house or after you get in the house?
It's more about coming back in.
More about coming back
It's
in.
like when you come back in from the grocery store, uh, really it starts at your car.
Yeah.
Like, as soon as you get back from the grocery store, you've touched money, you've touched public things, you've touched all the foods.
Yeah.
And so sanitize before you start touching your steering wheel and all your knobs.
So,
Yeah, so you start there.
so
And then
everyday
you come in
things.
the house and then you physically wash your hands.
Yeah. Everyday things normal people would take for granted. So like your
Yeah,
keys, like you said, the grocery cards, money, your wallet, your debit card. I mean, everything touches that. Sometimes you got to hand that off to other people.
right.
Um,
And I mean, sanitizer is not the answer because, this is a virus and not a bacteria, so it's a little harder to
right.
get off your hands. So ideally, you want to physically scrub down with soap for
That
like 30 seconds, like the CDC recommends, or I mean,
that
maybe they
gives
say
hope to
20
some of us out
seconds.
there because you can't find hand sanitizer on the shelves right now.
Yeah, yeah, and that's no worry. You can use soap and just scrub your hands. Make sure you use hot water.
Hmm.
Scrub it for a good
Hopefully
30
everybody's
seconds with
got.
a good lather. And if you have sanitizer to use afterwards, that would be
That's a
ideal.
bonus.
But
Or in
that
emergency
also,
situations.
you have to, run that sanitizer around your hands for a good 15 seconds. If
Gotcha.
not, you're just partially doing the
Defeating the
job.
point.
So,
Let's kind of go over this a
yeah.
little bit. The pandemic going right now. It's a mutation of the SARS virus. Stands for severe acute respiratory syndrome. This is the coronavirus version of it. COVID-19. It was discovered in 2019. As of today, March 21st, 2020, there's worldwide 271,364 deaths. That's up 30,000 since yesterday. Um, we were going to do this video yesterday, but we had some technical difficulties. We didn't even want to do this today, but we figured this is some information that has to go out there because there's not a lot of information on it.
Well, there's a good thing that's coming out now, and it's the telehealth.
Yeah.
And there's a lot of the big hospitals that are doing it. I know UC Health is one of them, and I believe I've got some emails from UPMC in Pittsburgh
Okay.
where you can go into their own sort of chat line, and within an hour, of answering a few, like a questionnaire,
Yeah.
like an intake form if you went into the ER, and you can talk to a doctor.
Yeah.
And with a doctor, he can, watch you breathe. You can put the phone showing the inside of your mouth if there's any swelling, and
Wow.
kind of help guide you to
Right.
go to the ER or not, because they don't want people going to the hospital. That's already the
Oh, for
place
sure.
for germs. So
They're building field hospitals all
yes.
over the place. I know there's a Navy, like basically a floating Navy hospital on its way to New York City. They're really ramping up across the country, which for a lot of people are saying no cause for concern, but they're not doing this without reason, without good cause. They say 9 days behind the European curve, just due to lack of reporting and misinformation that went out there. So, and lack of testing. I mean, we've been behind the rest of the world in getting people tested. We had no priority showing it on ordering testing, issuing
We still
testing.
are.
Yeah, it's disgusting. It's
So
sickening.
numbers are still not truly accurate
Right.
of what's going on,
So-
what's out there in our own backyard.
Yeah. Long story short, we're here today to make sure that everybody's able to take care of themselves without freaking out, without going crazy. There's no reason for people to rush the streets and riot. But but for real though, there's a lot of crazy stuff going on.
Yeah, the grocery stores, they get a little tense over this past week.
Guys, if you're gonna prep, just know what supplies to get. Try and find. I know it's hard to find, but try and find gloves, masks, sanitizer, rubbing alcohol, a thermometer. A thermometer is one of the big things. They're really hard to find, but one of the first things is you get a fever before most of the other symptoms before the other symptoms set in, basically.
And one thing I would like to say with that, with gloves, I don't think that's really necessary unless you have a special case at home.
Yeah.
Because really, you just need to focus on getting into the lifestyle of washing your hands when you get home.
Yes.
Sanitizing your hands after you get out of a public location or a public
Yeah,
store.
and I should clarify too.
And that leaves resources for the medical staff
Right.
and caregivers so they can wear the gloves to
That
help
is a
care
good
for
point.
the ones that will ultimately end up being
Oh, for sure.
sick in this.
Should still have some on hand, but like you were saying,
don't-
not
you
to
don't
freak
need a
out. Don't
crate.
wear them all the time. Only wear them if you know you're going to go
if
somewhere
you're-
where you possible exposure.
Yeah, if you're interacting with a high risk situation.
Yeah, because other than that, like Andy said, wash your hands, use hand sanitizer. Don't rely on hand sanitizer. Actually, wash your hands, hot water, 20 seconds. But like, if you got to sing the ABCs twice during washing your hands to make sure you do it thoroughly, wash each finger. Like, it's transmitted easily through your eyes, through the membrane in your eyes, your nose, your mouth. So if you've been touching stuff, don't touch your face. Just try not to touch your face. That's going to be the number one way
Next
of
step in
preventing
your
it.
lifestyle change
Yeah.
is remembering what your hands just touched before you go to touch an itch.
Don't rub your eyes. Don't pick your nose. Don't
anything.
bite your fingernails.
Yeah.
I mean, it sounds stupid,
Well,
but a lot of
speaking
people
of
have those
fingernails,
have those habits.
A good tip with that is keep them short.
Yeah.
The less they can hold, any less debris, dirt they can hold, the less chance you're going to be packing something around
Oh,
like
for sure.
the virus that would get infect someone else, if
Yeah.
not yourself.
And if you have these symptoms, pull yourself away from people immediately. Just
Absolutely.
don't starve yourself. Obviously,
call the
keep
doctors.
a contact line. Call your doctor. See what they can do. We're supposed to be getting relief on this soon. We should be getting free testing. I don't know how far that is. From what I understand, the governor's still squabbling over things. But like I said, we're doing this so you guys can prevent yourselves from getting sick and prevent others from being sick. So if you're coughing, you've got fever, you got difficulty breathing, muscle aches, you're tired, step back for a second, kind of assess the situation. Severe symptoms, you'll start to develop pneumonia, acute respiratory failure, sepsis, septic shock, and even death. So catch it early, because they say if you catch it early, the symptoms are mild.
Absolutely. Much easier to treat when it's early.
Yes.
And I mean, the same way it goes with the flu, too. It's any virus. The sooner you can get on top of it, the easier it is to get rid of it.
Oh, for sure. Higher risk people with diabetes, hypertension, cardiovascular disease, cancer patients, transplant patients.
Any immune suppression.
Yeah. You guys are all at higher risk. So I don't want to use the word luckily, but luckily you've been kind of training for this for a long time.
In a sense.
Sanitize everything coming in and out of your house. If you go to the store, sanitize everything coming in. Make a plan with your family, with your wife, your husband, your children. Know what to do. Like if you still got to go out and work and you still handle things, before you get out of the car, put everything that's coming into the house, put it in one spot. Your wallet, your keys, any cards, sunglasses, anything you bring in the house, throw it in a plastic bag. Bring it right in. Sanitize all your personal items. Throw your clothes in the laundry and go get cleaned up. Wash your hands, take a shower, do what you need to do. But yeah, don't infect your family. All right, so that's really basically a decent breakdown. I don't think we have a whole lot more information. There's still not a lot out there. The only thing I can say is use critical thinking. When somebody says comparing it to other diseases, remember this is a new one. When they say stuff about SARS was a really bad one, and it was a version of this. But just remember that it's totally different.
And a lot of it is just hygiene.
Yeah.
I mean, get into a routine and stick with it religiously.
Yep. Rely on
Is
yourself.
what you have to do.
Trust on yourself. Trust on your family. Make sure and inform your family. Let them know what the symptoms are, so that way they can tell you in case anything's wrong. Just general information. Don't let your friends tell you what it is and what isn't. If you go to these websites, you get the facts. Don't berate them. Don't talk down to them, but just inform them. People need to know. And if they don't want to listen, don't force it. Just tell them best of luck. Don't be mean, because eventually they're going to come around to it, and they're going to see who was nice to them and who wasn't, basically.
Yeah, and really, we just need to get all the fiction out of the equation and get down to the facts.
Yeah, get to the fiction.
Try not to spread any
get down to
medicine
helping each other out.
Fixes to this, and look it up for yourself. Everyone do your own research and find the facts.
Yeah, and check on your friends. Check on your family. This is a time that even though everybody's separated, this will be the last video we make for a while. But also, you guys, if we go down under quarantine here in Colorado, Andy and I are going to, before we leave today, we're going to figure out how to get Skype set up, and we'll do updates either daily, every other day. We'll go live. But yeah, we'll make sure and do everything we can to keep you guys informed.
Yep, sounds good.
Cool. So in the meantime, stay clean, wash your hands, don't touch your face. Talk about it to your friends, talk about it to your family, talk about it to older family members, anybody you can, and just be yourself out there and just try to take care of each other.
Yep.
All right. Well, Andy, thank you so much for coming back again, despite the conditions.
Thanks for
we know
having
the
me.
risks. Just one more thing. Now, this was a huge risk for Andy to come here today. So this is pretty much probably going to be the last day that Colorado won't be under quarantine. So you won't see us together for a while. And if you're taking it seriously, if you have the chance to just kind of hang out for yourself for a while, especially after being out in public and being around a lot of people, take a few days. Just the weekend. Take a few days,
It's a good time to rest.
Yeah.
Always a good time to rest.
Chill on the couch, watch some Netflix, watch some Hulu.
Open a book.
Yeah. Read a book. Yeah, nobody does that anymore. But
Kindle, whatever your thing is.
Anyways, stay safe out there, guys, and just have a great day. Live your lives.
All right.